I'm Herb London, the president of the Hudson Institute. The country is now engaged in a full-scale debate on the future of health care. The Obama administration has made it clear that it wants to eliminate waste, try and reduce costs. These are understandable and certainly appropriate goals. The question is, what are we giving up in order to achieve these goals? One of the things that has to be understood by Americans is not the arcane finances that are associated with health care, but rather the extent to which health care and the options associated with health care will be reduced as a result of the initiatives taken by this administration. Personal freedom will not be the same in the post-medical care program that the Obama administration has in mind. For one thing, you will not be able to select your own physician. For another, the likelihood is the kind of care or treatment will not be determined by the patient and the physician. It will be determined by some bureaucrat who is looking at a computer program that suggests certain age, life expectancy, and the kind of care that is appropriate for that person. The word appropriate as opposed to best possible care is the word that has been used by Ezekiel Emanuel, the person who's in charge of these matters, and the brother of Rahm Emanuel. So that we're talking about a very different kind of health care for America. One of the things that I think is appropriate, as I've suggested, is to eliminate waste. It is not appropriate, however, to reduce personal freedom and the kind of choices that are available to individuals at the moment in health care in the United States. I say the United States because there are one player or one carrier healthcare programs around the globe, and by and large they don't work very effectively. The increased number of cancer patients in England clearly suggests that they have a triage system, and if people don't fit into the program that's been adopted by the National Health Care of England, they are not going to get health care in an appropriate or timely manner. So the issue that has to be addressed here is, we have the best possible health care in the world. Do we want to sacrifice that because of the desire of this administration to introduce a new system? That's a question I think all Americans are going to have to address, and a question that should be addressed by the Congress of the United States.